Hey there, health warriors. Ever feel like there just aren't enough hours in a shift? Between charting, administering meds, answering call lights, and handling emergencies, delivering patient-centered care can feel impossible in an overloaded system. But here's the truth. Even in a fast-paced environment, small changes can make a big impact on patient care. Today, we're diving into how nurses can prioritize patients, manage time effectively, and still provide compassionate, quality care. Let's get started. Nurses are constantly under pressure. Short staffing, high patient loads, and endless documentation can make it feel impossible to give every patient the attention they deserve. Common time constraints nurses face include high patient-to-nurse ratios, excessive charting and documentation, unpredictable emergencies, and non-clinical tasks. So how can nurses manage their time while keeping patient care a top priority? Let's break it down. Prioritization is the key to effective time management. Use the ABCs and Maslow's hierarchy of needs. Address life-threatening issues first: airway, breathing, and circulation. After ABCs, prioritize pain relief, mobility, emotional needs, and discharge planning. Know the difference between urgent and important tasks. Urgent tasks include patients in distress, critical labs, and time-sensitive meds. Important tasks include documentation, patient education, and routine care. Cluster care to save time. Instead of making multiple trips, combine tasks like giving meds while assessing vitals. Plan ahead so you can address multiple patient needs in one visit. Being proactive instead of reactive can help nurses stay ahead in a chaotic environment. Communication is crucial to making every second count. Be clear and concise in patient interactions. Simplify instructions and use teach-back methods. For example, instead of saying, "You need to take this medication 3 times a day with food because of X, Y, and Z," say, "Take this with meals 3 times daily." It helps absorption. Use SBAR for team communication: situation, background, assessment, and recommendation. Delegate when possible. Let CNAs, LPNs, or support staff handle non-critical tasks like bathing and restocking. Trust your team. Nursing is not a one-person job. Time-saving communication techniques can prevent delays and improve workflow efficiency. 3. Documentation efficiency. Chart smarter, not harder. Chart in real time when possible. Document immediately after an assessment. Avoid end-of-shift backlog. Use charting shortcuts like smart phrases and templates if allowed. Avoid over-documenting. Stick to objective, necessary details. Don't rewrite the same note multiple times. For example, instead of saying "patient tolerated procedure well with no complications," simply say "procedure completed. No distress noted." Use bedside charting. Update the electronic health record while in the patient's room to cut down on after-shift charting. For example, while assessing vitals, input them immediately into the system. More time charting means less time with patients. Find ways to streamline documentation. 4. Maintaining compassion in a fast-paced setting. Small moments make a big impact. Eye contact, a reassuring touch, or a kind word takes seconds but builds trust. Listen actively. Even if you only have a minute, patients know when they're being heard. Explain delays and acknowledge patient needs. For example, saying, "I know you've been waiting. I'll be right back to help you as soon as I finish with another patient." Reduces anxiety and makes patients feel valued, even when time is tight. Take care of yourself too. Even a 60-second deep breath or stretch can reset your mindset. Prevent burnout. You can't care for others if you're running on empty. Efficiency matters, but compassion is what patients remember. Nursing is demanding, but patient-centered care is always possible. By prioritizing tasks, streamlining documentation, and making every interaction meaningful, nurses can deliver exceptional care, even in a fast-paced environment. Nurses, what's your best time-saving tip? Share in the comments below. Like this video? Give it a thumbs up. Subscribe for more nursing strategies and patient-centered care tips. And remember, efficiency meets compassion. Prioritize smart, care better.